when we talk about our clinical studies, when we talk about our quality controls, um, people think, well, that's the same thing I heard from company X, company Y, company Z. So you really have to start to really appreciate the Shaklee difference. You need to take a little bit of a look at what other companies do. So that's why the first half of my book, Slaying the Supplement Myths, I devote to what I call the lives of the charlatans. So let me just give you a couple of examples. This one was from about 10-ish years ago, 10 or so, but a group called the Mateel Environmental Justice Foundation sued a major manufacturer of fish oil, omega-3 fatty acids, and all the big box stores that sell those sorts of things in the state of California. And what they'd done is they'd analyzed the product and found that it contained high levels of PCBs. And California, everything is supposed to be, they got the Proposition 65, which passed, which means that everything has to be pure. So, and it turns out this one manufacturer really didn't have any quality controls. Their product was contaminated, and they just sold it to all the big box stores who put their own labels on it and labeled as their own. And some of them told you it was ultra pure and so forth and so on, but it was all contaminated. The interesting thing is they were sued under Proposition 65, which isn't a law that regulates the quality of a product. It's a fair labeling law. So the amusing thing about this, they were literally sued because the label didn't say omega-3s plus PCBs. But, what was the consumer to know? It was omega-3, it was inexpensive. What's not to like? There's another example where somebody in the Shaklee home office went to a store in Pleasanton and they saw this protein supplement on the shelf. And the label looked great. It was organic, non-GMO, talked about all the wonderful things it did. But they took it home, they tested it in the Shaklee analytical labs and found it was contaminated with lead. So again, it really didn't mean California Proposition 65 specifications either, but it was organic, but it was still contaminated with lead. And what happens is organic doesn't mean pure. I talk about that in my Slaying the Supplement Myths book. Organic really just simply says how it was grown. You can still get impurities that come via groundwater, spray drifting from adjacent fields, all sorts of things. So unless you do the quality controls, you don't know if it's pure. That's why Shaklee talks about beyond organic, because it's not just organic. They do the quality control test to make sure that there are no contaminants. There was another example I cited where a group of scientists at Princeton analyzed 21 supplements that contained grapeseed extract as one of their ingredients. And when they ran them through the analysis, six of the 21, only 6 of the 21, actually had grapeseed extract. 9 of them had peanut extract, 3 of them had pine bark extract. I kind of want you to think about that for just a minute, because you don't start with peanuts and expect to get grapeseed extract. You don't start with pine bark and expect to get grapeseed extract. That has to be intentional. By the way, did I mention that peanuts and pine bark are a lot less expensive than grape seeds? But you have no way of knowing. The label said it had grapeseed extract. And by the way, if you had a peanut allergy and you bought this product with grapeseed extract, you had no idea that it might cause you harm. But final example, and it's interesting when you actually look at some of the FDA reports. So this is a company on their website that talked about they had the finest raw ingredients. They went all over the world to get those ingredients. They tested them for purity. They ran quality control tests in their final product. Everything was as pure as a driven snow. It was stored under ideal conditions. The FDA actually shut them down. And the FDA, when you read the FDA report, none of the things that they claimed on their website were true. It was all marketing. They didn't have any quality controls. They didn't store them under ideal conditions. They didn't actually test for purity. All of that was just made up information. It looked good, sounded great, but it wasn't true. So this is where Shaklee's commitment to quality control really comes into view. I mean, you've heard the specifics, the numbers. They screen for 325 pesticides, whereas the industry standard, that's what good companies in our industry do, is screen for 105. They perform as many as 1,000 quality control tests on a single product. That would be like the vitalizing plan. That's one SKU, one single product. 1,000 quality control tests. 100,000 quality control tests a year. You've heard all of those things. They test both the raw ingredients and the final material. They reject anything that doesn't meet the specifications, even if it means their customers do without. So there's one example, and I guess this is insider information in a way, so I won't tell you the product, but it was a product that came out recently, and they had promised it, they had introduced it to the top leaders who meet in Pleasanton every February. They'd introduced it a year and a half prior to that. They were planning to come out that April. They'd already tested 2 lots of the raw material. It met all of their specifications. And then the 3rd lot came in and it failed. They contacted the company and they said, oh, well, we meant to send that to somebody else. They don't have as stringent specifications as you do, but they decided, well, we're going to go back to the drawing boards. We're not going to trust that supplier. And they spent the next year finding the perfect supplier, doing the control test over and over again. They actually introduced it the following April, a year later in April. But they had to get it right first. Think about what most companies would do. They'd already told their top field leaders that they were going to introduce it that April. They failed the specifications. They'd probably say, well, no harm, no foul. We'll figure it out. We'll just roll this out in the meantime. Shaklee doesn't do that sort of thing. Let's talk a little bit about the proof. And here you've got to be kind of a detective, because everybody claims that they've got the proof. They do clinical studies. So one of the things you have to ask is, are they animal studies, or are they test tube studies, or are they actually clinical studies that were done with people? Did they do studies with their product, or did they borrow science from somebody else's product? A clinical study that was done with somebody else's product, they're quoting that, but it wasn't actually done with their product. Do they publish in advertising journals? Now, what's an advertising journal, you might add? Well, there are actually journals out there in which you pay the journal a certain amount of money, and they guarantee that they'll publish it. That whatever you say, they'll publish. Peer-reviewed journals are a whole different level Since I was a research scientist, I'm really familiar with peer-reviewed articles. I published over 100 of them. I can tell you, it's a very stringent process. You do the study, you write it up, you send it off to the journal, and the first thing, the editor reviews it. And if the editor doesn't think it's up to snuff or not right for the journal, he or she will reject it. But then they send it out to your peers, who also happen to be your competitors, and they review the journal and say they review the study, and they say, well, was the hypothesis a good hypothesis? If not, they're going to review it. They're going to reject it. Was the experimental design adequate to test the hypothesis? Because if it wasn't, they'll reject it. Did you collect enough data of the right kind to test your hypothesis? Did you do your statistics right? Do your conclusions match the data? If you fail on any of these things, the paper will be rejected, or at the very least, they'll ask you to rewrite the paper, maybe redo some experiments. It's a very high bar. So you really want the peer-reviewed studies. And then the final thing you want to ask is, was it done by their scientists, or some scientists that nobody heard of in India? It was really interesting. I was talking with somebody, this was about a year and a half ago, and they were with some other company. And they were very proud of the fact that they couldn't get anybody in this country to test their product, so they had to go to Russia and have somebody over there test it. And I'm thinking, we have Nobel Prize winners who are testing our products. What they were saying made no sense. But you want top-notch investigators at major universities who are doing the studies. That's because, I've done because I developed some very useful techniques for analyzing potential cancer drugs. I was asked by a number of drug companies over the years to do studies for them, testing their product. And I can tell you, before I could sign one of those agreements, the university lawyers would go over it, and they would make absolutely sure that that I had full rights to publish whatever I found. If I found the product didn't work, it wasn't up to snuff, the company could not influence or stop the publication. The only thing the company could do is if I discovered something patentable, they could delay publication by 6 months to give them time to file the patent. But that's what happens when you've got a top-notch investigator at a major university. So again, when you look at that, Shaklee excels in clinical proof. I just checked on the website. We now have 141 clinical studies and scientific presentations with Shaklee's products. Almost 100 of those are published in peer-reviewed journals, independent studies, top-notch investigators. This is the difference. But finally, if you look at the landmark study, this, I think, is the most remarkable study that we have. And I'm sure if you went to the convention, you heard about that. But what that study actually showed was the Shaklee group had improved health outcomes. This was a 20-year study. People used the Shaklee products equivalent to the vitalizing plan for 20 years or more, had better health outcomes than people who took other companies' multivitamins or took no supplements whatsoever. If you go to any other company, the best of their clinical studies will show that their supplements affect biological markers, things like cholesterol levels, triglycerides, markers of inflammation, that suggest that somewhere down the road that those products might influence health outcomes, but they don't prove it. We're the only company that has that. And the interesting thing is, that study was published in 2007. We're 12 years later now. So other companies could have done a similar study if they had confidence in their products. Not a one has even tried to replicate the landmark study with their products. So that's really one of the reasons why I think that Shaklee is unique. But and if you look at the companies out there, there's so many of them that are bogus, that don't have good quality controls, that don't have good studies. But there must be some out there. And there are some that have some pretty good list of clinical studies. Their quality may be good, I don't know. It's easy for me to evaluate the clinical studies that a company cites, but it's very difficult for me to evaluate the quality of their products. And I have no way to evaluate this quality control and product claims because I don't have access to their data. So this is why I am so confident, because Shaklee's given me unique access to their quality control. I've looked at their quality control specifications. I've looked at their product designs. I've looked at their clinical studies, walked through it with their scientists. I've seen the list of questionable ingredients that they'll never use. I've inspected their quality control labs. I've talked with their quality control specialists. Their equipment is state-of-the-art. The quality control processes are exceptional. I've talked with their scientists about product designs and clinical studies, and I've asked the hard questions. don't, I, I've challenged them at times, but they've always been candid and transparent. And their answers are usually educational rather than disappointing. Um, there might be other companies out there that have quality control, product design that matches Shaklee's. But unless they're willing to give me that kind of access, I can't verify those claims, and neither can you. So, so that's sort of my summary. That's my, short version of the Shaklee difference.
That was great. Thank you so much. Hey, a couple quick questions here, I guess, and if anybody else has them, please type them in the chat. But one question would be is how were you first introduced to Shaklee? And two, how long have you been with Shaklee?
Oh, golly. So I was first introduced to Shaklee by my mother-in-law, and this was about the time we got married, so this would have been 51 years ago. And Suzanne had been using the products for, since she was 16 or 17, something like that. So she'd been a Shaklee product user for a while. And so we got married, and her mother had this business, so we said, well, the nice thing to do is to support her. So we bought some of the products. She put this little green pill by my plate. You might know it as Vital E. And I just took it along with what I ate, and I noticed a difference. Fewer colds, I felt better. And her mother was very convincing. But I'm a scientist. I was studying to be a scientist at the time. I was getting my PhD degree. So you might say I was a skeptic in training. So I really researched what she said, because I was like many people. Well, she talked about clinical studies, and I said, well, everybody must do clinical studies. Doesn't the FDA require that? She talked about quality controls, and I said, well, everybody must do quality controls. I mean, nobody would make a supplement that wasn't up to snuff. That was my belief, and it's the belief of a lot of the people you talk to, which is why I say you have to kind of understand the bad to go with the good, which is really why I wrote that book, so you would have that as a reference. And people are saying, oh, but every other company's great. I don't mention Shaklee in there, and that's on purpose, because I want that to be something where there's no barrier to people reading the book. But by the way, in that book, there's a link to a website where I have a video that talks about the things I just talked about, why I recommend Shaklee. So that's accessible there. It's behind a questionnaire, because you can't put this thing out for open distribution. But that's I did the research, and I became convinced that Shaklee products were exceptional.
So now you're a professor now. How do you tie in Shaklee when, obviously it's at a university compared to Shaklee being multi-level marketing? Are you able to talk about Shaklee and their standards, or how do you introduce Shaklee to people?
Well, I'm retired now, so that makes it a lot easier. I'm what's called a professor emeritus, which just means honored professor who's gone. But when I was there, you really aren't allowed to talk about things like that as part of your job, as part of your. So I really didn't build any maybe a customer or two just by happenstance. People who were talking, I said, well, call me at home. We can talk about this. Couple of customers, no business builders that actually came from the university. So all of these were people who we knew, who we met over the years, who were outside of the university. So I think the bottom line is, yes, if you're in a situation where you can't talk about Shaklee at your job, that's okay. It doesn't necessarily have to slow you down.
For sure. No, and I think that was all great information. I know there's a lot of newer Shaklee friends on this Zoom, and I think that it's really important to truly get why it's so different, and hearing from someone like you that obviously has the knowledge and knows so much more than we do from the testing standpoint. That was great information. So thank you for sharing that. And I'm just going to ask real quick, because I don't see any more questions in the chat, but if anybody want to unmute themselves and ask.
I have a quick comment, just because it kind of goes along the lines that he was talking about. My husband was a lab chemist locally here, and he did quality control for and testing for lots of different companies. And one of them, I didn't know it at the time, but one of them was Shaklee, and the specifications were very different for Shaklee than what he did for all the other companies. So
that's wonderful information to share.
I have a question and a comment.
Yes.
I have your books, and I've given them to multiple people for gifts, and I basically give them away at every turn. I think they're valuable information. I really appreciate it. So thank you for writing them. And something I don't think that you covered, because it's been a little bit since I've read it, but is CBD oil, or CBD in general. Kind of what is your take on that situation? I know that Shaklee has been studying it for a little bit, but I just wonder kind of what your take on the investigative end is.
Well, it's an interesting question. So I think, based on what I know about the Shaklee scientist and the way I go about things, that if Shaklee were to come out with a CBD oil, one thing you could be guaranteed with is it would be high quality, ultra pure. And the problem is the CBD oil industry, nobody is doing those kind of quality controls right now. Some of the CBD is contaminated with THC. Some of it is synthetic analogs of CBD. So again, quality control is a huge issue, and you will know that you've got good quality control. The difficulty that Shaklee or any reputable company faces when they start to think about making a product with CBD is the FDA hasn't decided yet how they are going to regulate it. The FDA held a couple of major conferences. They invited in experts from all across the country. And the consensus was that, and sort of my personal feeling, CBD oil is likely to have some benefits, but we have absolutely no proof that it does. The clinical the studies are very small, they're poorly done, they're conflicting. You're not going to be able to make any claims about CBD oil other than you've got ultra pure CBD oil. Now, that's not stopping some companies from making claims, but the FDA is reaching out to those one by one, slapping them on the wrist and saying, hey, if you do this again, we're going to shut you down. So you're going to see less and less of that as time goes along. Mm-hmm. But they still haven't set clear standards.
Right, because it could be medically, I heard that something about them, it might actually be classified as medicine because for epilepsy, and so that might be actually regulated instead than...
Yes, if you've talking a disease like epilepsy, it would be considered a medicine. Mm-hmm. Now, that doesn't mean if you knew the dose that was effective and you had an ultra pure product that you couldn't use it for that purpose. So yeah, epilepsy is one of the ones for which there is actually fairly good proof. It's likely to be effective for inflammation and some of the other things, but you go beyond that in terms of the mood and relaxation and that sort of thing. It's not clear whether that was CBD or contamination, or product was contaminated with THC.
Mm-hmm. I appreciate it because I get a lot of questions about that. So thank you.
You're welcome.
Perfect. Well, thank you. I know we're out of time here, Dr. Chaney. So
oh, yes. We are about out of time, aren't we?
make sure that we were good with that. So I, again, appreciate you taking the time to join us here. And if anybody else thinks of more questions, if you don't mind, maybe I'll pass along something to you if somebody wasn't able to unmute themselves. But again, thank you so much. And you guys, if anybody's staying on for the business training, we're going to continue on here for a little bit. But again, thank you so much. We wish you the best and have a great night. Thank you so much.
You too.
Thank you.
Thanks, guys.